Hello, everyone, and welcome to the Quorum Podcast. This is where academic medicine meets remote, austere, and resource-limited areas.
Welcome back to the program. This week, I'm with Dr. Slaven Bajic. Slaven is an emergency medicine doc. He is on our teaching faculty. He teaches our ultrasound courses. Slaven, welcome to the program.
Thank you very much, Aebhric, and it's always a pleasure to cooperate with Quorum.
So you've been teaching for us for about a year now, haven't you?
Yes, around 1 year, I think now.
Tell us a wee bit about yourself. Who are you and what do you do?
I'm an emergency medicine specialist, and I'm leading ER in Izola General Hospital in Slovenia. It is a small touristic hospital, only hospital on Slovenian coast. And now, especially during the summer, we handle a lot of patients and tourists from all the Europe. I'm also an emergency ultrasound instructor for Quorum and for EUSEM and for WimFocus. So I take a special part of a lot of time from my job for also teaching the younger doctors, residents here with ultrasound.
So, yeah, we'll talk about that. That is interesting that your hospital popped up last week. I was in Norway again, and we were running a prolonged field care course. And one of the doctors said he really likes your hospital. It's set on a hill, is that right? And you can just look out over the ocean?
Yes, it's on the hill, and you have beautiful view on the Adriatic Sea and Slovenia and Italy. So it's really beautiful. When the patients we need to admit to hospital, we tell them, don't worry. I mean, you will have a view like from the best hotel.
Yeah, I'm looking forward to seeing it. Last week, I was in Ljubljana. It's my first experience in your beautiful country, and I was floored. Slaven, your country. Yes. I mean, from the very beginning of coming in from Croatia, and just seeing the greenery, and then of course you have the Alps north of Ljubljana, and then just walking through the old town. I was stunned. It's really beautiful.
Yes, thank you. Slovenia is really, it's not so known maybe like some bigger countries, but it's very beautiful. Small, but it has everything, like from the Alps and the Adriatic Sea and the like mix of Balkan, Mediterranean, Central European culture, everything for somebody.
You went to med school there, is it?
No, I actually finished med school in Belgrade in Serbia.
Okay.
But after that, again, here, residency and for emergency medicine, I finished here, yes.
So you've taught for us in a few places now. You've taught in Malta, you've taught in Glasgow. So tell us about your experience. We met in Malta. You taught on an Austere Prehospital Ultrasound course right there in Pretty Bay. How was your experience?
I liked it a lot, really. It was my first experience in Malta with Quorum, and I liked the concept of the 2-day APOS course. I mean, I like because there's a lot of practical work for students. That's the most important with ultrasound, just to do it more, because if you don't do it, you will forget. I always tell that to students. When we teach you, just do it as much as you can. That's the best. And the concept of your APOS basic course is really great. I liked it in Malta, and then we did it again in Glasgow. So I'm looking forward to do it again.
So we have more courses planned in Malta. We have more classes planned in Glasgow at the Glasgow Caledonian University. And we'll see how this postgraduate certificate goes. We submitted to the European authorities to get a postgraduate certificate in Austere and Prehospital Ultrasound. At Glasgow, you really enjoyed Glasgow. We had a few pints in some of the pubs, and you've been to Scotland before.
Yes. Actually, after Slovenia, I think my favorite country in the Europe is Scotland. I love it, and I was thrilled when we had the opportunity to have a course in Glasgow. So I really enjoyed it, and course and the free time. Really, I love Scotland.
Well, once it becomes EU again, maybe there's a chance for you to do some locum work in some of the hospitals there.
Well, we will see. Yes, actually, I planned also to license in NHS, and then I can do some locums there sometimes because I really like it.
Yeah, I agree. I'm part of the Royal College of Surgeons of Edinburgh with their faculty advisory board. I'm up there again in a fortnight, and any excuse to get into Scotland, I agree with you. And I graduated from the University of Stirling, so I have deep roots, and I agree with you. It's a beautiful country, but then so is Slovenia.
Yeah, thank you. Yes. Yeah, I'm
Yeah,
also thrilled with Scotland, not only with not nature beauty, but also with their culture, history, proud, everything.
indeed, indeed, and the museums there are fascinating. The Medical Museum in Edinburgh is
Yeah, I
one of the
visited
best in the
the
world.
Royal College of Surgeons Museum. It was really great experience.
Yeah, it's stunning, and just having the history in those walls, it's any excuse to go back is always a good one.
Definitely.
So you teach ultrasound for the college,
Yes.
and you also teach ultrasound for the European Society of Emergency Medicine.
Yes.
And
Yes.
yeah, so what do you see as the difference between the USM POCUS course and the college POCUS course?
Basically, the principle for basic courses was similar. We had one instructor per 4 or 5 students, also in USM, also in quorum, which I think is the optimal. So basic principle is same. Only in USM we had the more massive courses with more people. But as I said, basically is the similar. I like more practical work. I think we had a little more practical work in quorum. Basically, the principle of the basic course is same, but there are some differences. We had the more massive courses in USM on the congresses of emergency medicine and like some congresses we organize here in my hospital. I like it because like in USM, in quorum, we have like one teacher for 4 to 5 students, which is optimal. More than that, it will be too much. In larger groups, you can disseminate information to a larger number of learners at once. But I
Hmm.
think there is not enough time to everybody to repeat it, to do it more times, as I said. So definitely, I like to teach it.
So how many, you say massive, how many students would you have? What's the most students you've had in an ultrasound course?
Yes, yes. For example, we organized last time in our hospital ultrasound course of in emergencies, abdominal emergencies, and emergencies in shock, and we had about 50 people. But as I
Wow.
said, also we had 10 instructors because you need one instructor for 5 people, and then you have time to teach everybody exactly what you need.
How often are you using ultrasound in your practice?
Basically every day. I work in the ER, and we have a very good ultrasound machines here. We basically every day, because we look at trauma patients and internal medicine patients and pediatrics and definitely everything. So a lot of times every day.
And is there another organization you teach ultrasound for?
Also for Vim Focus, I'm instructor for Vim Focus.
Okay.
So local activity, and in Slovenia and some ex-Yugoslav countries like Bosnia and Serbia and like that.
You also spend time in Africa. So and which kind of piqued my interest when I first heard about what you're doing. So you've been to Africa. Tell us, where have you been and what were you doing?
Uh, I was uh, I was leading ER in Role 2E Hospital of European Training Mission in Mali in Kulikuro. So basically, around 2 months, I was leading ER there in Mali, and it was one of the best experiences in my life, definitely, to see because I worked generally here in hospital, so it was my first experience like that, and definitely great.
So who were you treating and what organization were you with?
I was working for Icarus. They are like international organization that has a hospital in remote areas, military bases in
Hmm.
more dangerous, how to say, areas.
Right.
Uh, we were there, for, like I said, a Role 2E military hospital in a European military base. And our patients were European soldiers from many European countries that they are serving there.
How long were you there?
It was 2.5 months.
Wow. So yeah, just nonstop.
Yes, yes, yes. Definitely, we were there all the time, and I was a senior ER doctor, that basically leading ER. But we had a team with junior ER doctor, traumatologist, anesthesiologist, and some other doctors that they were helping us, and of course, EMT group for their like pre-hospital doctors that they were going out from the base.
So, what are some of the cases that you would see in Mali?
Well, the most of them, they were like trauma cases because it's a young population, soldiers without some chronic diseases. So most of time, trauma cases, wounds or general trauma.
And you had ultrasound at that clinic as well?
Yes, yes, we had the ultrasound in clinic and the portable ultrasound that it could go to the ambulance vehicle. And it was very good because we were very limited there with diagnostic possibilities. We had only X-ray in clinic, and the nearest CT was in Bamako, the capital of Mali, which is 1 hour and a half driving. So ultrasound was a great advantage to us. I also organized the course for ultrasound for other colleagues that were working there. It's a great help in areas like that, in remote areas where access is limited to other resources. Ultrasound is very good because machines are portable. You can transport them to remote locations, to the field. It provides real-time imaging, so in the same time you can have some conclusions when you're checking the patients. This is the crucial for the on-spot diagnosis and decision-making on the field. It's non-invasive, as we know. It can be used for a wide range of applications, and it's, of course, cost-effective when you compare it to other modalities like CT scan, MRI, and everything, and basically no harm for patients.
Indeed, it's interesting to hear that it was a benefit to you in those resource-limited environments, and in Mali where you are working out of a Role 2, or did you say Role 2 or Role 2E?
Role 2E.
Okay. So you had some. What does that mean? You have a neurosurgeon, is that right?
No. We had orthopedic and trauma surgeon, and general and abdominal surgeon.
Are you planning to do that again, or are you planning to go anywhere else in Africa?
Yes, definitely. I got some offers. They offered me there to stay as the medical director of that project in Kulikura, but I was still under the contract of my hospital, and it was a hard decision to make, stay there or to come here. I came here and then back to Slovenia, but I'll definitely go for next locum opportunity for sure because I like it a lot.
And you're running the emergency department there in Izola.
Yes. In our hospital, we have a nice emergency department, and we have a lot now, a new emergency doctors, residents, and we are trying to really push it to be one of the best in all country.
But you have a lot of holiday makers, don't you?
Yes. A lot of tourists from, Italy, Germany, Austria, Czech Republic. Every summer we have double work in summer. So we double our stuff. We don't have double stuff. So that's the problem. We have double work, and we need to work much more than we are used to.
How many doctors do you have during the summer?
We have general in our department. We have 3 emergency medicine specialists and 8-9 residents. But it's not enough. We also always need help from surgical residents, internal residents. They're helping us to control the TR because emergency medicine is a young specialization in Slovenia. It started before 15 years, so we still don't have enough staff that we can cover all shifts in ERs in Slovenia.
So it's a teaching hospital as well.
Yes, definitely. We teach young doctors, residents, interns, and especially in our ER, we take a lot of care for them, to teach them a lot of things when they start their job.
Which university is it affiliated with?
With Ljubljana Medical School. But we are connected with medical chamber, so when they finish there, the medical chamber, they send the young doctors, residents to our hospital, like to other hospitals in Slovenia.
And you're doing ultrasound training there in the hospital?
Yes, we do ultrasound training in hospital. we start with interns, with young doctors. During their stay at ER, we always try to teach them at least basic things of ultrasound, like fast exam or to check for pneumothorax or abdominal aorta. So we are always trying to teach them. And also residents, of course, we teach our residents.
So on your ambulances in Slovenia, what do you have, nurses or do you have felchers or paramedics? Who mans the ambulances?
We have everybody. Because before, when it started, emergency medicine, most doctors, emergency doctors, they worked in ambulances. And then we tried to go to Anglo-American model of emergency, like the doctor should be in ER and the paramedics, they go out. Yep. But we still didn't do it totally because, as I said, we don't have enough staff. We don't have like real paramedics like in UK and America. They don't have all competences. Our EMTs, their ambulances, they don't have all competences like paramedics. So it's some like mixture here. We have some doctors, and many of us work in ERs, but we also do shifts in ambulances, and it's like that in all Slovenia. You don't have clear pre-hospital or hospital role. It's some mixture of that. But I hope one day that we will go more to Anglo-American model because I like it more. That ER doctor is in ER and paramedics are out.
But there's some advantages of having a doctor pre-hospital. So here in Germany, my wife's German. I've retired here in Germany. And it's a mix. So you'll have paramedic, yes. But then you'll have a doctor in a little car. In Ireland as well, it's the same way. So you have a South Doc or a West Doc in a little tiny car that will meet an ambulance. In Scotland, where Tom Allison works, it's the same way. Is that do you think that Slovenia would move into more of a European model of having paramedic on the ambulance, but then having some of your docs on a car pre-hospital?
I think that the doctors will still stay here in pre-hospital because, first of all, many of people are used to work in pre-hospital, and now if you would put them in the ER, they will probably not come because they love their job in pre-hospital. I also love sometimes, working in ER, it's really tiring sometimes, and I sometimes really like more pre-hospital work. It's more than, I don't know, to go out, and there are also some advantages of pre-hospital because you bring a higher level of medical knowledge to patients outside, and you can more quickly you can handle some really emergent medical conditions.
Well, one advantage is you get to sit down in pre-hospital, don't you?
Yes, you can have a little rest in comparison with ER because although you can, as I said, it's better for patients because you can perform some more advanced procedures on the field, like intubations, chest tube. I don't know what are the competences in paramedics in USA and UK, but can they do intubation there?
Yeah, so intubation, chest drains are rare. It's more of advanced paramedic, like me as a critical care paramedic might have that, and RSI is a critical care paramedic, so that's the advanced level, and there are definitely options. But the difference is we just don't have the 7 years post medical school that you guys do. So I'm not only 4 years of med school compared to 3 years for a bachelor's degree paramedic. You have 4 years of med school or 6 sometimes in some countries, plus another 5 to get the board certification. So you have 10 years of experience on us. So it only makes sense that you're there in pre-hospital environment to provide better care.
Yes, definitely. I think it's more better for patients. That also our dispatch guy, he when we had a call, for example, for ambulance, then he decides. He depends from the kind of call. Then he decides he will send only like EMTs or doctor with them. So for more emergent conditions like traffic accidents, traumas, coronary syndrome, and things like that, always doctors go with them. They don't go alone.
It's the same here in Germany and in Ireland where I've worked. That makes sense that the dispatch is making that decision.
Yes. For us, is also, I told you, good. All my colleagues, I work, for example, 80% in ER and 20% in pre-hospital care and some night shifts. So all my colleagues here in ER, they mix it with pre-hospital work, which I think is also good, that you little change your working area and like that, and to see all range of pre-hospital conditions, not only in ER.
I think it adds to the camaraderie as well. So these felchers or EMTs that are on your ambulances are seeing you in a pre-hospital. You can talk to the doctors and have a relation of an understanding of what the paramedics can do, so the doctors understand what we can do, and then we have a relationship with you. And then when we bring someone into the A&E department, we already have that connection and camaraderie. I just think that makes a better EMS system.
Yes, definitely, and it's always more fun and more better atmosphere for pre-hospital teams, I think, than in ER.
Indeed. And there are some paramedics that do that as well. So I've worked A&E for 4 or 5 years as a paramedic, and there are some places where the paramedic will be in the hospital and then a call comes and they'll get called out pre-hospital. So it goes both ways, that we can be in the same situation. But I think it'd be 60-80 for us as well, where 80% of us would be pre-hospital and 20% later hospital. So kind of opposite the way you have it at the moment.
There is, I don't know, did I mention you before, but in Czech Republic, every year in May, it is Rally Ravis. It is the biggest European pre-hospital contest for pre-hospital teams.
Yes, I've heard of that.
Yes, actually, every year I'm a referee there. Before.
Oh, nice.
Before I was also competing, but now I'm a referee every year, and it's great. People, pre-hospital teams come from all Europe and from UK and from USA and also from Japan, Australia. Yeah. So it's great to meet all those colleagues, and it's really fun and great. You should visit that place once.
I definitely do want to. And I remember working in the Budapest Hymns, and on their wall there's all these rewards from that competition.
Oh yes, those guys are the best. They win every year. Every year the Budapest team wins. I don't know. Their guys are supermans, really.
Well, I've seen the training they do. And Matches is their training guy, and he pushes the teams pretty heavily. So when there's no call, and instead of sitting around and watching telly, he'll have the mannequin out. So it does make a big of a difference. Yeah,
definitely.
So your passion is ultrasound. What changes would you like to see in ultrasound in the coming years?
Well, I think that ultrasound in emergency medicine is future generally. I mean, it is the stethoscope of the future, because more and more things we are doing with ultrasound. And I would like that all doctors, junior doctors, have at least basic knowing of ultrasound, which makes good, better care for patients. And especially emergency residents and emergency specialists to be more advanced in ultrasound. Today you can't work emergency medicine with ultrasound, and that's the future. I think in the future we will be able to do and more things with ultrasound. For example, now in Switzerland they also do in ER some ultrasound with contrasts, and they basically yes, I have good friends there in Switzerland, and they don't call a radiologist anymore for ultrasound in ER. They do it. They call a radiologist, for CT, MRI, but they do ultrasound. And I want that one day to be also here in Slovenia, and I'll do my best to come to that.
Nice. I didn't realize that ultrasound contrast was done in the A&E department. That makes a lot of sense.
Yes, that's the future also here.
Yeah. What advice would you have to our listeners who are just starting out learning ultrasound? What can they do to improve, or what suggestions do you have for them to be better providers?
So first of all, to learn. So I always advise to everybody to go to every possible course of ultrasound and basic and advanced, and then special kinds of ultrasound like musculoskeletal and everything. So go educate as much as you can and do it. I always tell that also, as you remember, to our students in Malta and Glasgow, just do it all the time. When you have some free time, also do it, also on healthy patients, because as you said before, it's better than to lie down and watch telly. Do something useful. So you will forget it. If somebody teach you something and you don't do it, you forgot it. I know that. So just repeat as much as you can, and that's the best way. Just learn and repeat.
So I look at this as hand knowledge. You can get the head knowledge while watching the videos. Or Life in the Fast Lane has 108 case studies on ultrasound. Fantastic to go through, but that's head knowledge, and it's not until your head knowledge gets transferred to hand knowledge, and your hands can do the skills. That's the difference.
Definitely. I hope that in the future that everybody could afford like small ultrasound machine like Butterfly or VScan, or that allow them to use them also in diverse settings, remote areas, not only in ERs.
Yeah, a Butterfly is showing up in more and more places in remote areas. I go to Kabocho District Hospital, which is up the hill, up Mount Kilimanjaro, and it's like jungle area. And you walk in, and their A&E department has Butterflies. They're pretty much everywhere now.
Yes, definitely. And I think in future probably that AI, artificial intelligence, will play a significant role in probably automating those images, analysis, making it more accessible to less experienced colleagues. We will see. Who knows what will be.
I saw one. It's called Econus ultrasound,
Yes.
and at the Summit conference last May, and it's just a phased array. So we're looking at basically just cardiac, which is my worst subject anyway for ultrasound. But you get a long axis view with this probe, and you hold it there, in about 2 seconds on your screen, it shows you what you're looking at with the left atrium, left ventricle, the aorta, and it just labels it. So you can go anywhere in the body, and the AI is part of the probe software. It will label whatever you're looking at.
Oh, it sounds good. Very good.
Yeah, it's 6,000 euros, so we don't have one at the college yet. But so you're right. AI, I think, is the future for ultrasound. I think those guys are leaps ahead, and everyone's going to start following them. So AI is already changing healthcare a bit. It's easier to look through PubMed articles by asking ChatGPT to do that than it is to actually go through and look at all the articles on that. It's definitely helping me as a writer. So it's just a matter of getting that on an offline environment so you can use it in austere environments, and that's the challenge for AI anyway.
Yes, definitely. We have now in Izola, we are first hospital in Slovenia. Now we have like experimental AI program for X-ray.
Nice.
Yes, I connected with ASMED from France. They have programs in a lot of hospitals in France, Switzerland, and we have like now experimental phase for 2-3 months. It's like additional help. We have like connected with our informatics system in hospital, so it's very good for younger doctors that they started because the program automatically recognize fractures. And when you open to see on computer the patient X-ray, you already have like pointed with some square or round with program where's the fracture. And nice. Okay, of course you can't really reliable only on that. You watch by yourself, but it is great additional help. And we are doing it first now in our ER in Slovenia. So I really like the program, like additional help.
That's fascinating. AI, everyone's complaining of saying, oh, it's going to take our jobs. It's just going to take over everything. But if we look at this as just another data point, just somebody else to talk to bounce off ideas, it doesn't mean that they're going to take over the world, but it does mean that the radiologist would be able to have that analysis of AI before they even look at the film. But it doesn't mean they're not going to look at the film. They're going to just use AI to help. We do this with ECGs, don't we? So we do a 12 lead, and they already says, well, this is SVT. Well, that's nice, but let me look at the actual. Oh, okay, you're right, that's SVT. But I'm never going to just assume that what the Life Pack 15 tells me is correct. And I'm hoping
yes.
with AI, it'll be the same for us.
We can't rely only on that. It's good additional help, but we always rely on our clinical decision. And of course, future of emergency ultrasound, as I said before, looks very promising. Also with AI, also without it, it looks very promising. It will improve patient care, enhance diagnostic capabilities, and I think the best is still to come.
I think the next 18 months are going to be profoundly changing our healthcare approach and hopefully making more tools available to us.
Definitely, I agree.
So, Slaven, it's been great to chat with you. You're coming down to Malta. I'll see you next month, and you're bringing another doctor, aren't you?
Yes. I advertised a little bit here in Slovenia to some colleagues, and one doctor that she's also working in family doctor but works in emergency. She's interested and she will come, and I hope some other colleagues we will see. But I really I'm looking forward to it again.
Well, I'll definitely have to buy you a pint there at the Water's Edge Hotel and look out over the bay. And it's a pleasure to chat with you, and you're a very big benefit to the college and being on our faculty. I appreciate you joining the team.
Thank you very much. I always, as I said, it's always my pleasure to cooperate with college and with a great team of all of you. So thank you.
This has been a presentation from the College of Remote and Offshore Medicine. If you would like to earn CPD credits for this podcast, you can join the Council of Members. Being a member of the college gives you free CPD credit, free access to our virtual field guide, and discounts on our e-learning courses. You can join the team on our college website at quorum.edu.mt.